learned that infant mortality has increased in our country. It's not because I came in here. It's because of what happened during the Biden administration that we're going to end.
Do you accept the fact that 1 million Americans died from COVID?
I don't know how many died.
Kennedy in the hot seat. A fiery Capitol Hill showdown as HHS Secretary Robert Kennedy Jr. faces a Senate committee. Fox 11's Phil Schuman joining us with really some fireworks there.
Yeah, I mean, that's a good word for it. It was actually the Senate Finance Committee that Kennedy appeared in front of. He may have thought they just wanted to hear his plan to, quote, make America healthy again, but senators quickly attacked. It seems our healthcare system, to put it politely, is in turmoil.
Sir, you're a charlatan.
The grilling of HHS Secretary Robert F. Kennedy Jr. came from senators on both sides of the aisle on Capitol Hill.
I would say effectively we're denying people vaccine.
Senator Cantwell. You're wrong.
Kennedy defended the firing of the head of the CDC and other top scientists. His critics see that as a sign of chaos at the agency.
We are the sickest country in the world. That's why we have to fire people at CDC. They did not do their job. This was their job to keep us healthy.
Secretary Kennedy also said that he believes former officials had conflicts of interest, political agendas, and they failed Americans during the COVID-19 pandemic.
You're the Secretary of Health and Human Services. You don't have any idea how many Americans died from COVID?
I don't think anybody knows.
Kennedy faced hours of intense questioning, not just over COVID, but also things like the rise of measles.
How am I a threat?
Secretary Kennedy, for the first time, we're seeing deaths from children from measles. We haven't seen that in 2 decades. We're seeing that under your watch.
Kennedy was also pressed on his stance on who can or who should receive the new COVID-19 vaccines. The FDA has only approved the latest version for people 65 or older or younger people with underlying health conditions.
You promised that you would not take away vaccines from anyone who wanted them. You just changed the classification of the COVID vaccine.
I'm not taking them away from people, Senator.
It takes it away if you can't get it from your pharmacist.
Meantime, approximately 1,000 former and current HHS employees have stated that Kennedy needs to resign or be fired. Neither of those actions appears to be happening. And this comes as COVID-19 cases are rising across Southern California. Schools are back in session. Wastewater levels are measuring high. State officials say test positivity rates from late last month just hit more than 13% in LA County, around 18% in Orange County, and that is a sharp increase from July. I spoke with a Cedars-Sinai epidemiologist about what this means. How concerned should we be?
Well, some things with COVID stay the same. Some things are changing, but I think the mechanics of the virus are the same as it's always been, right? So COVID remains a respiratory disease. The symptoms that we're seeing in patients are primarily upper respiratory symptoms with some pneumonia. So the transmission is the same. The symptoms are essentially the same as what we've been seeing for the past few years. And the preventative measures are essentially the same. So the things that worked before are the same things that are working now. And so just using those respiratory precautions, if you are sick, stay home, don't go to work, take those appropriate precautions, get tested,
Masking,
vaccines, all of those things still highly, highly relevant.
And in case anyone needs a reminder to take this seriously, heard that figure of 1 million deaths nationwide. More than 100,000 Californians have died from COVID since the beginning. Fortunately, right now, even though the test positivity rates are up, the rate of hospitalizations is currently very low, although that also is increasing.